Everybody, thanks so much for listening to Fire, Breathe, and Rob. If you're listening to us for the first time, we really appreciate it. Definitely share this interview and get it out to many people. We have a special guest, a man of medicine, a man of art, a man of writing. He's a man of everything, and this is Mark Stratus. He's back on, and last time he was on, he spoke about his book, and I definitely hope people go out and buy it. And we're going to tease that actually before we go into the healthcare system. But Mark, first of all, thanks so much for coming on. I greatly appreciate it.
Thanks. I enjoyed last time.
Talk about the book so we can tease it. If people did not see the last interview, we went really in depth into it. But since we have Mark on again, before we start the full-on interview, just tell the viewers a little bit about the book before we go into healthcare and cancer in general.
Yeah, thanks. It's called One-Legged Mongoose, a very strange title. It's a book that is narrated by the kid I was at age 10 to 12. And the kid tells the story close up, and it opens up when my father told me I'd be leaving public school and commuting 4 hours a day to a religious school in Queens, New York. And that was the start of an entirely new journey, which had tremendous ups and downs. I was a kid who was a veteran street fighter, and I expected Queens to be worse.
I want to talk about this, if you can give a quick answer, because I do want to get into and I really appreciate you, Doc, really going into that because it's important. And I think the viewers will really like that when they hear it.
I want to tell you one funny story.
Okay.
I've actually never said. So whatever listeners you have, we're going to break the news to them. When I finished medical school, I was starting an internship in internal medicine. I went on Medicaid for 9 months. And why did I do it? Because my wife was pregnant and I had no money. We had zero money. Our rent was a one room dorm, the two of us. Now a kid was coming, and I went into the Medicaid office and I applied, and this woman was really nice. And she's looking at me. She said, "We never had a doctor ever go on Medicaid." And I said, "Well, I qualify. My assets are way under $3,000 a year. I'm making no money, and we're going to have a kid, and I can't afford the visits, and I can't afford the delivery. The hospital bill will kill me." I said, "The day my wife comes out and goes home, I'm going to drop Medicaid. I can't do it. I have no resources." She put me on Medicaid. I qualified. I filled out the papers. So we were on Medicaid for 9 months.
It's really sad that this is still going on when there's been many presidents and politicians fighting for this issue, but there's a lot of people.
Very, very few people have fought for it.
Right.
Yeah. Clinton thought
Yeah.
he was going to do it. He put Hillary in charge. Right. That broke the back of that effort. Hillary thought she could change it. And she so underestimated the issues. And she was a little tone deaf. You know, they thought they had the answers, and it was far more complicated than that. And I think every president has steered away from it. They made campaigns saying, "We're going to fix this." You know, Bernie, you started off with Bernie, you know, and it's really important. His fix is Medicare for all. Mm-hmm. That's a hell of a lot better for the vast majority of people than what we have today. Mm-hmm. And I'm actually not sure it'll be more expensive. It won't fix it by itself. Mm-hmm. And I'm going to tell you why I think that's true. It's money. there are at least three main constituencies who get the money for health care: doctors, hospitals, providers of drugs or equipment. And that's pretty much all the money. When Obamacare was going to pass, or it was up for possibility of legislation, all the medical societies came out against it. All the hospitals were against it. I mean, they really pulled all their weight to stop it. It passed. The hospitals are now making more money. The drug companies are certainly making more money. What happened is that the hospitals figured out how to game Medicare, which is, how to reconstruct the emergency room, how to make surgery, same-day surgery whenever they could, lower the number of beds, do more throughput, get hospital rates for same-day surgery. I mean, the US, they're kicking people out of the hospital in 23 hours, where many of them should stay 2, 3, 4 days. But there's more money doing that. The doctors, not all, but many of the doctors figured out how to game the system as well. Get higher reimbursement for your widgets and do more widgets. The drug companies charge a god-awful fortune. They'll mark up a drug to whatever the market will bear in most cases. No president, no legislation has ever interfered with the charges in this country. And the same drug here may be 20 times more than in another country. So Medicare for all won't do it without the whole structure redone.
So, Mark, what needs to be fully redone?
We have to start off, and I don't think we have the capacity or the willingness to do it. We have to start off by looking at how we deliver excellent health care and how we support getting as many people good care as we can. Incentivize doctors to give good care. There are programs that have moved in that direction, but it's very hard for an outsider to determine good care. There are programs that have moved towards that, and there are some real pros. We have to revamp the cost of reimbursement to doctors, to hospitals. We can't incentivize them to do the wrong thing. One of the problems I think we have, it can't be changed without legislation. It can't be changed without the Senate of the United States agreeing. And the reason we have some of the political problems we have, and the reason most Americans are disenchanted with the political system, is the average senator supposedly spends 60% of their time raising money. And they got to raise this god-awful amount of money to run, and a congressperson, my God, every 2 years. But the Senate is really important, 6 years. The drug companies give a senator $5 million for their campaign. And they may even write the bill that they want the senator to vote on. The medical societies have a little less power, but some. Malpractice lawyers have a lot of power. And malpractice in this country is such a disincentive to good medicine. Malpractice is over $200,000 a year for an obstetrician. A very significant number of OBs in this country have stopped doing it. So the malpractice system is broken. The pay for certain kind of widgets in a totally disparate level. Not paying for quality, but paying for turnover. The other thing I feel very strongly about, and I would agree with Sanders and people on his side, we have to give people who are even here illegally good care. The reason is, look, we all know there are at least 11 million people in the US who are illegal. I mean, I don't know any better. Maybe it's 20 million. But even the Republicans don't want all 11 million to leave. They're just making a lot of noise about the new people coming in, you know, like, but they need this workforce. So you can live in my town in Westchester County, which is a wealthy town. You could be illegal here and your kids go to a high-end public school. They get sick. They don't have insurance. This is nuts. They're going to one of the best public schools in the United States and they get sick. They don't have money to go. They go into a hospital, they'll get a bill for $10,000 for walking in and out. If we're willing to have them work and we're willing to have them go to public school, give them health care. When they go in, when the parents go in, the grandparents, it's often when they're super sick and they wind up in an emergency and it costs the system far more money and their mortality and their morbidity is unnecessarily high. So, and that kid is who might try to do well has all these burdens on him. So my feeling is there should be universal health care. There are a lot of people who might not care, especially here in my state of New York, because a large number of New York physicians don't accept insurance. So the idea is, you know, I go to the greatest doctor, you know, and that guy might charge $100,000 for a shoulder. You got to write the check. They aren't necessarily better surgeons.
Right. But we do have a $3.5 trillion bill on the chopping block right now. And unfortunately, that's literally what it's on, whether it's on the chopping block to be passed or not, or it's on the chopping block to be chopped away, which is really a travesty because there's a lot of programs that people, rich, poor, whatever nationality they are, could really benefit from that. My opinion is it actually probably should have been higher, but that's the country we live in where things, you know, just automatically fall down. But with that said, Doc, can we go into this, the $3.5 trillion bill? It's there's a big pot, and you talked about this in your last answer about drug prices. There's a big pot that Senator Sanders has really pushed about negotiating drug prices with Medicare, also the dental, the hearing aids, etc. that, you know, they're trying to get in that bill as far as free because seniors have to pay for that. Personally, you know, the power of the drug companies, you know, the power of the physicians, the lawyers. We talked about this. Is that going to be in that final bill? Yes or no, and why?
I don't know. I mean, I don't know. The bill is so huge, and I don't know a lot of the details. I'll bet you very few senators have even read one sentence. I think they got the people working for them, and they got the lobbyists telling them what's in it. I think that.
Well, I guess just to top off when you said last time that money in politics is really the root of all evil right now in this country. And you talked about, you know, how these senators and congressmen and women get paid by these big corporations, whether it's fossil fuels or in the medical field, the list goes on, and how those companies and people own them now and they do their bidding. So my question is, if there's so much money that is being made off the system, and these people have millions of dollars they're throwing at senators and congressmen and women, then that seems to be pretty much dead on arrival because there's so much power in those industries.
I think the prices of drugs are often ridiculous. You know, there was a moment when I started practicing cancer medicine, we had the most common drugs were a few bucks a dose. A lot of money would have been 50 bucks a dose. I remember meeting with one of the companies because I did a lot of research on that particular cancer drug, and it was important to them. My research might have meant they were going to sell more drug. And the drug was coming, the drug was hitting the 19 years, and now it's going to be possible there would be generics. And the company was figuring, why should we put money into it? We're almost at the 19 years, and there's going to be a generic drug anyway. And I said, you know, there are cancer drugs that we cancer doctors won't buy the generic because we can't trust it. So we have something in our system that's so flawed. We watch, I mean, we're all looking at how the FDA is involved in the current vaccines. I mean, people have never paid as close attention to the FDA as now. You know, are they going to approve Pfizer now giving the vaccine to 5 to 11-year-olds? This is a big issue. The FDA, it's true, it's very expensive to get a new cancer drug approved. You got to go through these detailed and usually expensive studies. That's true. But anything over the counter, any homeopathic medicine doesn't go through FDA approval. A company comes out with a generic. Okay, we just made a generic of the cancer drug, you know, Cytoxan or methotrexate or 5-FU. They don't go through FDA approval. Worse than that, there's no system in the United States that does bioavailability studies on drugs. And this is important. What does that mean? I'm a cancer doctor. I want to give a patient 100 milligrams of drug X. And the vial says there's 100 milligrams in it, or a pill says 100 milligrams. Nobody checks if that's true. You go to a pharmacy, buy something over the counter, and they say, you know, you're getting 1,000 units of vitamin D. You don't have a clue whether that's true. And so as a cancer doctor, there were many times when I felt this drug dose is reliable. And as a researcher, there were moments when I checked that. I needed to check how many milligrams were really in it. But you have some other company pushing the drug. I very often wouldn't use a generic in cancer drugs. So I was telling that company, don't worry about it. This particular drug, we're not going to the generic. And they wound up raising the price, which is not what I hoped they would do, and making way more money when the generic came out. You know, the system of, you know, 19 years generics, it's not that there shouldn't be generics, it's uncontrolled.
Dr. Strauss, so my question is, when we talk about cancers, can you talk about the most prevalent in men and women? And how do we prevent these cancers?
The 3 most common cancers we have, aside from skin cancer, you know, which, you know, the vast majority isn't serious. But the 3 most common serious cancers, lung cancer, breast cancer, colon cancer. Now, lung cancer still probably kills the most people. And my earliest clinical research was in lung cancer. And I thought as a youngster, I'd really made a difference. There was one cancer. Can you imagine, with an average survival from diagnosis of 3 months, I got it to 17 or 18 months.
Wow.
Didn't cure it.
No.
Didn't cure it, but that was a huge leap. Lung cancer remains almost as lethal if you get it as 40 years ago. Mm-hmm. And that's a whole other discussion why the dial hasn't moved that much. There's no question that well over 95% of all people who get lung cancer are smokers. And the rate of lung cancer relates to the amount and the number of years that people smoke. You know, there are other environmental issues which may be additive, but I remember, and it's in my book opens up the first sentence. I'm a 10-year-old. I'm on my way to the first Hebrew lesson, and my mother's a chain smoker. We're in the car, and my face is encased with this cigarette smoke. And, you know, the first time a Surgeon General of the United States ever said that lung cancer kills, I believe, was 1964. You had to have your eyes closed to think it wasn't true before that. And yet, there were Senate hearings where the heads of tobacco companies were saying there's no evidence, you know. Oh,
sounds like climate change almost now.
Well, climate, I mean, it was even more obvious with smoking. I mean, climate change, it's really obvious, but I mean, the data are 1-to-1 with smoking. You see how much somebody smoked who died of lung cancer. Those are easy statistics. These people worked hard to fight it. The best thing that ever happened to the cigarette companies was they were forced to put on the cigarette box, "This thing can kill you." Because once they put it on the box, you couldn't say they didn't tell you. So it was harder to beat them in a lawsuit. They fought doing that, and it saved them a lot of money. Now you want to smoke, you know what's going to happen. Breast cancer is very different. Breast cancer, there's very little that we know we can do to prevent it. I mean, there are some smaller things we know that have some impact, but largely breast cancer is genetic. And, you know, you look at a woman's, the history of siblings, sisters, mother, grandmother, aunts, that tells you a story. There are also really important genetic tests that help us, you know, better understand the potential to get breast cancer. But breast cancer has probably increased in prevalence. Lung cancer is decreasing in this country because smoking is decreasing.
Right.
And the third one, colon cancer, which is men and women, colon cancer is largely preventable with routine colonoscopies.
Doc, I'm told that now there's men getting breast cancer and more men than usual. Is that correct, or is that bad information?
There were always men getting breast cancer.
Okay.
It could be something like 1% of all cases. Is it more? I actually don't know. I don't know.
Okay.
I want to say this, it's such a huge issue. I said before, we don't even check the amount of drug that's in a drug.
Yeah.
So, you know, you're talking about drugs that we take to try to help us. What's in the food? I mean, the whole organic industry, a lot of things they say is organic isn't organic.
Yeah.
You know, it will be so hard to prove which of these factors cause increase in what disease. We know it's happening. We know as an aggregate, we're eating some things that have very bad ingredients.
Right.
Pulling that,
and go ahead.
yeah, I mean, pulling it apart and trying to understand what impact it has. It's going to be difficult. Look, if people are able to manage to stay slimmer,
Right.
they're better off. If they eat really sensibly and cautiously, they're way better off.
Right.
But I'm going to have to go.
All right. Well, with that, we'll sign off. Dr. Strauss, Mark
Thanks.
Strauss, definitely check out the book. And I appreciate your time. I have your email address, so we'll definitely get in contact with you again. Dr. Strauss, it's a pleasure. I appreciate
Thanks,
you.
Rob. You too.
We'll talk
Take
soon.
care.
All right. Bye-bye.